If you receive Medicare benefits, you need to pay attention to how the government is changing those benefits as we move into 2026 and beyond. In November, the government released over a dozen different press releases and fact sheets outlining changes to Medicare and Medicaid, and some of them are pretty profound. Some of those changes will help you, some of them may hurt you, and some of the most important decisions haven't been finalized yet. In fact, right now, the Centers for Medicare and Medicaid Services is asking the public for feedback. They want your opinion, which means this is a perfect time to make your voice heard. Your opinion matters on this, and if you don't speak up, then the insurance companies are going to shape the rules, and we all know that their goals may not align with yours. So it's important to understand what changes are already being made, what changes are being discussed, and most importantly, what you can do about it. And we are going to go over all of those things today. Now, I will tell you that a lot of those updates were long and tedious and technical and didn't really seem like they would affect you on the day to day. So there's a lot of information that we read that we're not necessarily going to cover today because I don't want to waste your time. If you like to get into the nitty-gritty details, you can find all of those updates on the CMS website. We're going to show you screenshots of the ones that we referenced as we move through this slide deck. And remember, if you are on Medicare, I just want to remind you that this is the last week for open enrollment. You only have until December 7th to make adjustments to your plan for 2026. So if you haven't already looked at the changes to your coverage and what's going on with your plan and what your options are, I would encourage you to reach out to our partner chapter. They offer a free advisory service. They can look at all of the different plans in your area, make sure that your doctors, your medications, and everything that you need are going to be covered as we move into the new year. You can give them a call at the number that you see up there. And I love working with these guys because I don't know about you, but I feel like Medicare is way more complicated than it needs to be, right? There are over 20,000 different plans out there. They all change every year. It gets overwhelming very quickly. So I'd love to hear from you in the comments. If you think Medicare is too complicated, just drop a quick yes or no and let us know, because I'm always interested to hear your opinions. Now, with that, let's dive in and talk about what is already changing. Okay, these are going to be things that have already been issued as final rules. These are already done deals. And then once we're done talking about all the changes that are already going into effect, we're going to talk about what they're still discussing and how you can make your voice heard on the changes that they haven't finalized decisions on yet. So let's start with what we already know. So we know that Medicare costs are going up in 2026. They've released the new cost sheet for Parts A and B, and we know that there are going to be higher deductibles, higher premiums, and this is going to make it harder for people on fixed or low incomes to budget for their care. So it's really important to know what's going on before this takes effect. We know that these new prices are going to take effect on January 1st, and they include a Part A hospital deductible of $1,736 and a new standard Part B premium of $202.90 per month, which is a lot. So like I've said in other videos, if you are low income, there are other programs and plans out there that can help you cover these out-of-pocket costs. And again, Chapter is the best go-to resource for figuring out what you may be eligible for. If you're interested in a deeper dive into all of the changes on these costs, we did another video on that recently, so I'm not going to rehash all of that here, but you can go check out that other video for details. Now, there is some good news in these releases as well. So we know that CMS has negotiated lower prices on 15 major medications that help with cancer, diabetes, asthma, and other chronic conditions, which brings the total number of negotiated medications to 25. The first 10 negotiated price changes will go into effect on January 1st of this year, and then the 15 that they just negotiated will switch to lower prices on January 1st of 2027. We know that around 5.3 million people on Medicare relied on those medications in 2024, and they made up 15% of all Part D spending. So those price cuts should bring some real relief to a lot of people. And I'm excited to see if this is going to help you guys save some money. Now, we also know that some clinic costs are also going down. Right now, Medicare will pay more, and you will pay more, if the services you receive are done in a hospital clinic instead of a regular doctor's office. But starting in 2026, CMS is going to pay doctor office rates even if you're at a hospital-owned clinic that looks like a doctor's office. So Medicare isn't going to continue paying extra just because the clinic is owned by the hospital. Okay, this is good news because it should lower coinsurance for patients in those settings. So they're estimating that Medicare will save $220 million, and it will also help people save around $70 million in coinsurance costs in the upcoming calendar year alone. So that is a lot of savings that you guys can look forward to if you're getting your care in a hospital clinic. Now, they're also going to start eliminating the inpatient only list. This was a list of procedures that could only be done if you had a hospital stay as an inpatient. Now they're going to be phasing those out because they're saying that CMS now believes that the practice of medicine has evolved so that these procedures can be performed on an outpatient basis with a shorter recovery time. They're starting by taking off 285 mostly musculoskeletal procedures in the upcoming calendar year. This means that if you need one of those procedures, you could have a shorter hospital stay, and it could potentially lower your out-of-pocket costs for those procedures as well, which is fantastic because the hospital deductibles can be really, really high. Now, we also know that they are loosening the rules about what surgeries can be done in ambulatory surgical centers. Now, since ASCs often charge lower rates than hospitals, this can mean lower copays and lower out-of-pocket costs for you as a patient if you need those procedures, which is, of course, very good news because healthcare is just so dang expensive these days. It's nice to see changes being made that could lower those costs for a lot of people. They're also rolling out new hospital price transparency rules, and I'm really excited about this because starting in 2026, hospitals must provide meaningful, accurate information about the amount they charge for healthcare items and services. And they have to post real dollar prices, like the median amount paid and the 10% and 90% rates, so that these prices actually reflect what amounts insurance is actually paying. And this is going to help people get a lot better transparency so that you can price compare between hospitals. You can spot overcharges and push back when your bill doesn't look right. The rule is final and is going to take effect on January 1st of 2026, but CMS said that they're not going to start enforcing everything until April 1st of 2026. So that is something to look forward to in the new year. Along with that, they are also opening more competitive bidding for durable medical equipment, prosthetics, orthotics, and devices. And that new competition is expected to drive down those costs in 2028, which could mean lower copays for common supplies like glucose monitors, insulin pumps, catheters, braces, and so on. They're also adding some new things so that you don't have to hunt for suppliers. Certain items will be shipped nationwide, and this is going to help people in rural areas get better access to some of that equipment. They're also moving continuous glucose monitors and insulin pumps to monthly rentals, which will lower your upfront costs on that, and all of your supplies are supposed to be included in that monthly payment, and Medicare will be capping the price of that rental so that it can't get too high either. In addition to that, we are also seeing some other changes. They are going to be reducing how much they pay home health agencies, but they are going to make it easier to qualify for home health, which is good news. They're also removing questions about food security, living situations, and utilities from the Home Health Quality Reporting Program survey, and we've seen them make that change across many different surveys. So that's just kind of an interesting thing to note there. And of course, they're also radically changing how providers bill for skin substitutes due to the rampant fraud and abuse that we've seen in that particular billing. But now I want to talk to you about what hasn't been decided yet. So everything we just talked about, those are final rules, that's stuff that's going into effect. But what we're about to talk about now are the changes that they want to make. And some of these may be very helpful to you. Some of them may not be in your best interest. So it's important that you understand what's being discussed and how you can speak up and make your voice heard about these changes. So let's talk about some of these new proposals. So first up, they're talking about making massive updates to how plans get their star ratings. This is something that affects Medicare Advantage plans and Part D plans and how they're graded. They want to remove 12 different metrics and then add a new depression screening and follow-up measure, which would start in 2027, which would just kind of change how these plans are graded in the first place. But they also want to stop implementation on what was going to be called the Excellent Health Outcomes for All reward. Now, that was designed to give extra credit for plans who were providing great care for people with certain social risk factors like poverty, dual eligibility, limited English speaking, or living in high need communities. This was going to help bump up those plans that were providing extra good care for people who were particularly vulnerable. And now they want to scrap that as a quality metric. So that's kind of an interesting decision. And then, in addition to that, there are a whole bunch of other changes that they're considering as well. For example, they've proposed a new special enrollment period for when one or more of your providers leaves your plan's network. And I think this is actually really cool because what they want to do is remove the requirement that the Medicare Advantage organization and the Center for Medicare and Medicaid Services agree that this constituted a significant change. They want to remove that barrier so that they don't have to agree that it's a significant change, which would allow you to more easily change plans in the middle of the year if your doctor or your provider no longer accepts your insurance. I know that's a huge deal for a lot of people who really like their providers, so I think that would be a very beneficial thing for a lot of you. Now, they are also asking for requests for information on several different changes that they're thinking about making to Medicare Advantage. So first, they want feedback on how to improve Medicare Advantage plans so that smaller plans with better benefits can compete better. They're also exploring, this is a quote, modernization opportunities, including a next generation risk adjustment model that could leverage artificial intelligence and alternative data sources. I know that's something that a lot of you have expressed concerns about in the comments. So I just wanted to highlight that because this is your opportunity to leave them a comment and let them know what you think about having AI as a decision maker in your care as far as risk adjustments and things like that. So just be aware that that is one of the things they're seeking opinion on. They're also asking for feedback on how to better serve people who are dual eligible for both Medicare and Medicaid, because they're saying that the data shows that a lot of those people are joining CSNP plans, even though dual eligible people typically belong in DSNP plans, which can give you better coordinated Medicare Medicaid benefits. So they're asking for ideas on whether they should require these other plan providers to sign Medicaid contracts, or if they should make it harder for people to market the wrong plans to vulnerable people. Just different ways that they can help make sure that people are on the right plan and don't have gaps in care. Now, personally, I don't want to wait for them to figure out how to do this. That's one of the reasons why I recommend that you reach out to our partner Chapter, because Chapter has all the databases and tools to help you compare across all the different plans in your area so that you can make sure that you are getting the best possible coverage and you don't get tricked for signing up for one of these plans that maybe isn't perfectly suited for your needs. So it would be good if they can figure this out, but in the meantime, don't forget that Chapter's got your back and they can help you figure out what the best plan is for you in the meantime. Now, in addition to that, CMS also wants your feedback on whether Medicare Advantage plans should be encouraged or required to offer benefits that improve mental wellness, nutrition, social connection, and other things that provide a sense of life satisfaction. They're saying that a lot of plans offer flashy supplemental benefits instead of meaningful wellness support, so they're seeking feedback on how those benefits could be improved. I'm sure you guys have a lot of opinions on that because you guys have left us a lot of opinions on that in the comments. So I wanted to make sure that you knew about this opportunity to get them to hear what you have to say, because I can't really do a lot in terms of changing how this stuff works, but they can. So these RFIs are the only time that CMS openly asks the public for input on the changes they're thinking about making. So if low-income people, caregivers, and advocates don't speak up, then the only voice that CMS hears are from the big insurance companies, because you know they're making their voices heard, and you already know what they want. So if you have concerns about how your healthcare works, or ideas on how it can be improved or adjusted, or thoughts about the changes that they've proposed here, this is your moment to say so. The links to get to the Federal Register site are very long and very complicated, so we've kind of short linked it through our own website at lirlinks.com. You can see the link over on the bottom down there, and if you go to that link, it'll help route you to the right page to leave your comments on all of the proposals that we just discussed. However, there is still one more page where they are asking for different input. So in this other proposal, they want to make the Inflation Reduction Act's temporary changes to Part D plans permanent, which would include eliminating the coverage gap, lowering the annual out-of-pocket caps, and so on. And then there's this one that could affect you as well. They are proposing to reduce the regulatory burden by ending the requirement that Medicare Advantage plans send mid-year notices about your unused benefits. Now, I really liked it when they rolled out this rule because it means that if you go half the year without using all of the benefits that you're entitled to, they have to notify you about what you forgot to use so that you can remember and take advantage of all those perks. They're saying that that is a headache and a hassle for those companies, and they want to repeal that so that they don't have to issue those letters anymore. Now, they are also seeking input on approaches and opportunities to streamline regulations and reduce burdens on those in the Medicare program. So if you want to make your voice heard on that, you can go to the link that you see down there. That is a separate page than the one we addressed previously, but it's another opportunity to help get your voice out there on the things that matter most to you in your healthcare coverage. Now, I've already talked to you about how awesome Chapter is, so I'm not going to repeat that whole thing. I think they're fantastic. They're really good at answering all of the questions that I have had for them over the last year or so that we've been working together. And I really value how much they've been helping our viewers because we've heard lots and lots of great feedback from people who have reached out to Chapter and had amazing results. Right? Melissa said that after she was dropped by her insurance, Alexis from Chapter helped her get back on a plan and made sure that the doctors she needed most were in network. Brenda said that her new plan lets her get glasses and gives her $50 a month for over-the-counter expenses. Anne said that she spent 2 hours on the phone with Brandon going over all of her options, and she got her over-the-counter benefits back, better dental, better vision. And Christina said that Chapter has been outstanding. The person that she spoke to helped her get better Medicaid coverage. These are real stories from people who watch our videos who have had great experiences with Chapter. So I know we're running up on that open enrollment deadline, but I would encourage you to give them a call and see if they can help you get better coverage in 2026 because they'll know what all your options are. Now, just in closing, I know if you're on Medicare, you're also concerned about Social Security benefits. So don't forget to go check out our recent video on the bills that they're proposing that could change your Social Security, and I'll see you there.